Las Vegas is a very popular spot for plastic surgery. In fact, we're one of the top 5 cities in the U.S. for breast implants. The woman I spoke to got hers surgically removed after realizing the impact it was having on her health.
Being born and raised in Vegas and working at the strip pools, they're everywhere. So it's like what you do when you turn 20, 21.
Kayla Klapperick got breast implants in 2013. 5 years in, she experienced migraines, pain in her breasts, and rashes on her eyes, face, and neck.
For a good year and a half, I just thought I was going crazy. I was like, what's going on?
After years of unanswered questions, several doctors, and lots of research, she landed on breast implant illness and decided to undergo surgery to remove her implants.
When my surgeon went in, he actually discovered that my capsule was attached to my collarbone and to my rib. So that's why I was having all that pain on that left side.
Several weeks out of surgery, Kayla says she's already seeing major improvements to her health.
It was a hard decision, but I knew in the end, I was like, my health is way more important than how I think I need to look.
Dr. Jeffrey Roth, a board-certified plastic surgeon in Las Vegas, says while it is rare, Kayla's not alone, and he does remove implants for patients who request it.
And so it's kind of this amorphous constellation of symptoms, which means sometimes it's very hard to kind of diagnose and treat. So there's not like one test you could go ahead and get for and go, oh, there it is.
Right now, Dr. Roth says breast implant illness isn't recognized by most as an official disease, but medical studies are in the works.
Those studies really have kind of just started recently. So hopefully in the next few years, we're going to have more and more data to say, hey, is this a real entity? And if so, what's really causing this entity? And of course, get in front of it.
There is a specific type of implant that the FDA says can cause cancer, and this one does have research to back it. The FDA just finalized its guidance, recommending but not requiring a boxed warning. It says certain textured implants have been linked to anaplastic large cell lymphoma, or ALCL. It can be deadly, but Dr. Roth says the risk is extremely low.
What the FDA is trying to do and what the different groups that are pushing the FDA to do is basically make sure that people know what they're getting into and are actually getting informed consent and then going forward.
Dr. Roth says of the patients that come into his office to get their implants removed, about 85% of them feel better afterwards. He says if you're not sure implants are the right decision for you, to go in and talk to a board-certified doctor. He says he'd rather have someone spend 20 minutes inside his office rather than 20 hours on the internet. I'm Kelsey McFarland, 13 Action News.